It's another day with the physicians where your health is our business. Growth spot will end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the Training Culture on your regular program. Sensation, burning around the genital region. You might be having what is known as genital warts. At times it looks like berry, like grapes. Most times you think it's scarification marks or birthmark. You probably will be dealing with something that is sexually transmitted. If you want to know more why you have that burning sensation, why you have that feeling that something that looks like grapes, small grapes around the genital region, don't go away. Just stay tuned. Today on The Physicians, we'll be going down that lane where a lot of people do not want to discuss. When you have that burning sensation around the genital warts, when you don't even know what is happening to you, you just want solution. And most times, people you go to meet, they may just be the chemists, the pharmacists, or sometimes even dwelling with herbal medication. But there is an area of medicine, a specialist that deals with that area. My name is Dr. Ramona Yusuf Kadiri, and I'm always not on this show on a regular basis because I have my beautiful co-host. My name is Dr. Martina Agberi. I welcome you to The Physicians. Today's topic, of course, you have already heard that, genital warts. Memuna,
yes, please.
What do you have to say about this? Because oftentimes you have people come to tell you some complaints, itching, they have some discharge,
and that's it.
And some will tell you, I'll ask, when did it start? They will tell you it's been there for a while, and I have this burning sensation, I've been treating it. Some even went as far as using caustic soda.
Yes.
So will tell you if they use this match to like burn it, it will disappear.
I've seen people with such experiences because my dissertation, while rounding up my residency, was in the skin clinic.
Okay.
So I had quite a number of such people presenting, and it gave me a lot of ideas on this is something so many people are mismanaging, not knowing that you just one or two medication, it clears away. But of course, that ignorance, that lack of awareness, then some people may be even in denial that somebody is doing them. That is the reason why they have that issue. So, of course, we have our expert that is going to deal with that.
I'm particularly excited because this topic will let people know that you also have the clinics where you can have the dermatologist.
Yes.
Oftentimes people don't know we have dermatologists, those that deal with things, diseases that have to do with the skin. So we have the dermatologist today, and a whole lot will be unveiled in the course of the program. Stay tuned, don't go away. We'll be talking about genital warts. And with me here is a specialist. She is a dermatologist, a consultant. When you see her, you won't even know that that is the field of medicine she's decided to specialize in. Her name is Dr. Folakemi Cole-Adeife. Welcome to our program.
Thank you very much.
Welcome.
I'm very happy to be here.
let's get down to the business. What are genital warts?
Genital warts are sexually transmitted skin infections caused by a virus called human papilloma virus. So to the layperson, they may see a few bumps, little bumps around the genital area, maybe 1 or 2 initially, and then after some time it begins to increase in number and size. Sometimes they may be itchy, sometimes they may not be itchy, they may not be painful, sometimes they may be itchy and uncomfortable. And of course, they are a cause for social concern because, you know, with the presence of those bumps, they may have challenges with their sexual life. So that's what genital warts are, and it's quite common and is actually on the rise, on the increase. We're seeing quite an increasing number of cases of genital warts, you know, in young adults. So it's a very, very, it's said to be the commonest sexually transmitted infection today.
Any particular age group that is most common amongst?
Well, young adults, usually, because that's the age when people are most sexually active. And we'd say an age range of, you can find it in as early as 16 and then up to mid-age, 45, 50. Sometimes people older than that, but rarely. And of course, with the advent of HIV, we have very exaggerated cases because it's an infection that can be affected by the immune system. So where there's immunosuppression, where the immune system is not functioning well, it tends to be exaggerated. But even in people who are not immunocompromised, who are healthy adults, we still do see cases of genital warts. The human papilloma virus is a very difficult virus, very hardy, and it's said that up to 70 to 80% of people have been exposed to one form of human papilloma virus or the other. There are up to 100 different types, but the ones that cause genital warts, they're type 6 and 11 mostly. And they can be quite distressing and difficult to manage.
In your clinic, I want to know about the female to male ratio representation. Because the ones I have seen, mainly the females.
Oh,
the males come out with genital warts too?
Oh,
have
yes.
you seen them?
We actually see an equal number of females and males with genital warts. They're quite common in males as well.
When they come to you in the clinic, what reason do they have for coming? Is it because of the burning sensation or itching or something?
Actually, no. In most cases, genital warts are asymptomatic. They just are very uncomfortable about their appearance. They look very unsightly. And of course, with a young person who is sexually active, they may be ashamed to meet their partner. And that's usually the reason why, you know, they come to the clinic. They come and say, oh, we have these bumps, and I have these bumps in my private part, and they seem to be increasing. And they're always very shy, but eventually they open up and explain what the issue is.
If it's not taken care of, can it grow reasonably big, large, that it can impede the person from walking?
Well, not usually. Genital warts, in some people, actually resolve on their own.
Okay.
Yeah, they can actually go on their own, but in most cases they get bigger, they grow bigger, and the only time where we see people having very extensive, large-sized genital warts are where there is things like HIV in the background, where their immune system is really suppressed. But in a healthy adult, they may be there, but they may not be that big to affect them from walking or moving about. However, they cause a lot of concern with quality of life. And particularly social interaction, particularly sexual interaction. So people are very concerned about them.
Okay, you're talking about the quality of life, right? And then you've mentioned the human papilloma virus. being responsible. We know that when the patient comes and is positive to human papillomavirus, there are other disease conditions that you would need to look at.
Right.
For instance, we know about cancers in females.
Right.
So when they come, when they present like that, do you usually open up and tell you the challenges, number one, and number two, you said it is sexually transmitted.
Yes.
So you mean those that abstain or use a protective mechanism, are they free from having it?
Precisely. So because it's sexually transmitted, it is one of those infections that are contracted via unprotected sexual intercourse, usually with multiple sexual partners. Although in some cases it may be the other partner that has multiple partners. So it's always a difficult thing to determine. However, yes, because it's a sexually transmitted infection, there's always the risk of them having other STIs, as sexually transmitted infections. Because if you can have one, you can have others. So when people come to the clinic with genital warts, part of the counseling is to also advise them or direct them to be screened for other sexually transmitted infections as well. In females, you may want them to do a swab, a vaginal swab test. And in males, if they complain of discharge, they could do a urethral swab because that can be there. With the issue of cancer, yes, it's possible because the human papillomavirus is also responsible for cervical cancer and cancer of there's now penile cancer. However, you know, I mentioned that human papillomavirus, there are up to 100 different types.
Yes.
And the types that cause genital warts usually do not cause cancer.
Okay.
However, because families move together, it's possible that if you have one HPV, the possibility of having another type, which may be the ones that cause cancer, the malignant types.
You have vaccines for the ones that cause cervical cancer?
Yes.
For the HPV that causes...
There are even 2 available vaccines for HPV. One of them covers just the type that causes cervical cancer. The other one covers even for warts. Okay. So if a girl or a boy gets it early in life, even if they're exposed to HPV, they may not develop the genital warts. So those vaccines are available.
Okay. So Dr. Cole-Adeife, you'll be talking about the different human papillomaviruses, and of course the fact that if you have genital wart possibility as a female, you can also have cervical cancer and other cancer. So, but the truth is that we do understand how much it takes a lot of people to come out to even come to you. You just said it now that it's maybe for aesthetic reasons, because of the other sexual partner and all that. But we'll be right back after this short break, and we want you to tell us what are these signs, what should people see, what should they look out for, what will happen to them if they are experiencing any of these burning sensation. You know, we talked about that and the bumps, but there are so many other symptoms that will. But we want you to hold on. We'll be right back after this short break.
Genital warts. This is a sexually transmitted infection, which is the most common of all STIs and occurs in both men and women who are sexually active. My name is Olamide Akinla. Please join me to find out more from the streets.
It's just an infection that is being gotten by 2 people by intercourse or any other type of means, but it's normally gotten from, you know, intercourse, sexual intercourse.
There are infections that we get through sex when having sexual intercourse.
There are diseases that are being transmitted through sex.
Anyway, some of the causes are somebody not being protected. You know, you meet your partner you didn't protect yourself, you meet, from one person to the other, it actually, brings the issue or come about it.
It's bacteria like syphilis, and diseases like HIV.
Bacteria like syphilis and virus like HIV and AIDS.
Definitely, people are aware of it, but due to out of ignorance, they keep on living their life the way they want. They found that maybe any opportunity that comes around them, they have to use it. So that's the reason why some people fall a victim of it. So people are definitely, they are aware of it, but some people are ignorant of it. So that's why they fall a victim.
Well, people know about it, but they are still falling a victim of it.
Like people are weird, just that they don't really take it serious. Like once they start feeling that way, their mind, they'll just be like, it's nothing serious. Meanwhile, they are meant to go to the hospital for checkup, but they won't do that.
This, as we are doing this thing, is part of the enlightenment. All over the world, everybody know about that STD transmitted this thing. Everybody is aware of it. So the best way to enlighten the youth is this way of saying it everywhere, both in social media, television, people telling you this and that. Everybody is saying about it. So it is our own responsibility to take precaution about it, okay? So to abstain, because we are hearing about it. We have been hearing it both in television. People advise you, if you want to have anything with a partner, you got to protect yourself.
We have in the studio Dr. Folakemi Cole-Adeife. She's been talking about genital warts. One thing that is very striking that she said was that you now find it in young adults. That calls for concern.
Very.
Yes, it does.
In young adults,
Yes,
more. The prevalence is more. It really calls for concern.
Yes, so that's because, that's the age where
They are more
sexually active, more sexually adventurous.
Mm.
And the concern is that it means that there's a lot of unprotected sexual intercourse. So yes, there needs to be a lot more counseling about protection. Even though the forms of protection available may not completely prevent genital warts, but it will reduce them to a large extent. That's because the warts can appear in other parts, like areas that cannot be protected, for instance, by a condom. But the use of protection like condom, physical barriers, is one of the best ways to prevent genital warts, prevent sexually transmitted infections like genital warts. And then also emphasizing as much as we can on being faithful to one partner.
Exactly, being faithful to one's partner. We know very well that these sexually transmitted infections, right? There is this table tennis kind of infection. You take care of the patient.
Right.
She goes back, meets with the partner, comes back again, and you keep having the same infection. Is it not usually advisable to ask that individual to come with the male partner or the female partner?
Oh yes, we do. In most cases of sexually transmitted infections, it's important to treat both partners. However, in the case of genital warts, there's actually no outright treatment per se, and that's because it's a viral infection. Most viral infections don't really have a permanent cure. So there's really no drug or medicine that can clear it. If it were a bacterial infection, you know, we can give antibiotics. If it's fungal, we can give antifungals. With viruses and with HPV and genital warts in particular, most of the treatment is to remove the warts.
The warts.
Okay. Yes, because of the appearance.
Okay.
But it doesn't prevent them from reoccurring.
Again.
That was what I was going to ask. So it's not as if when you use the medication and it goes, the chances of reoccurring is still there.
There's still a chance of reoccurrence. However, what we've noted is that boosting the immune system of people who have it by encouraging them to eat healthily, to take a lot of fruits, vegetables, and also to avoid lightening or the use of lightening creams, which may affect the skin's own immunity, as well as, you know, internally by eating healthily. So good skin care and good general health, good general body care, and you know, and health can help to minimize, you know, the recurrence of genital warts. In fact, in some cases, when patients are seen and they are recommended the right skin care to use, given maybe some multivitamins and encouraged to eat a lot of healthy food, when they come for the next appointment, they find that even without any specific treatment, the genital warts may have reduced or some may have gone away. But in many cases, you still need to go ahead and treat, you know, either by application of something that will burn it off, or the use of what we call cryotherapy, which is freezing it off. So sometimes physically removing it is the only solution. But like I said, that does not prevent it from reoccurring if the underlying problem is still not addressed.
Beautiful. If the underlying thing is not addressed. For instance, for a female who had genital warts and was treated and got married, now having it again, what do you think will happen? Because we know it is sexually transmitted.
Well, it might be a cause for concern. It might be a cause for concern with her family, because the husband may be, you know, wondering what's happening, but it's a possibility. And in such cases, we do tell people that if you've had this problem before, it can reoccur.
So it's good to tell your husband.
Yes,
because it's there, it's viral.
Is in the skin.
Yes, that's what I'm saying.
Even if the person is still faithful with that one partner, the fact that they have been exposed in the past, they may have a reoccurrence.
Because the husband is one who is learned, he might begin, some things might just start to...
Well, in that situation, it would be good for the partner, whether the husband or the wife, to say that, oh, I did have it before, and the doctor had told me that it may occur again. So that they know that, you know, this is something that they've had, and of course look for best possible treatment
for it. But in situation like that, because it's a very sensitive topic, and of course you are married and you don't want challenges, such disclosure should be best led for the doctor to give proper guidance and counseling for a couple, so that would not escalate and degenerate or even break the marriage.
There are some cases where we've had to have
proper counseling.
The patient invite their spouse so that we can sit down and actually speak with them about it, and you know, after that, it's, like you said, kind of calm down whatever concerns the partner may have had.
Okay, for a pregnant woman with genital warts, how do you manage?
Well, in pregnancy, we usually, you know, will not really want to bother with that too much, and that's because pregnancy is a state of immune reduction.
Somehow.
Because of the baby, the body's immune system tends to be a bit, you know, the guard is down. So if they had been exposed before to HPV, pregnancy is a time when it may reoccur. And in such cases, we may just counsel and, you know, ask the lady, maybe after she's put to bed, after delivery, we can then address and treat.
Okay.
So for cases that they are not presenting with burning sensation, because you said they are quite asymptomatic.
Yes.
What are the other things that they should watch out for?
Well, the bumps, usually they start as little bumps. In some people, they will be uncomfortable. I mean, if they are, quite big, they can cause some itchiness, some discomfort, and when they sweat around the area, it might be quite distressing. So yes, any of those symptoms, and even with other symptoms like we mentioned, the presence of one STI may be accompanied by the presence of another. So it's not impossible for someone with genital wart to actually have maybe some discharge, which is caused by something else, and may needs to seek help for that. But what we like to encourage people to do is to come to the hospital early, because what we notice is that a lot of people may go out elsewhere, pharmacy, to a herbalist, and seek solutions, and come to the hospital when all those fail. Well, we usually advise people to come to the hospital when it's still, because anything is usually easier to treat in the early stages, when it's still small. By the time it becomes very big, then it becomes more difficult to manage.
Thank you very much, Dr. Cole-Adeife, for coming on our program.
Thank you.
And enlightening our viewers out there on genital warts. Now we know it is sexually transmitted, and with the aid of cryotherapy, it can actually be taken care of. But that does not mean you have total cure, because it is viral. It's viral. It can reoccur. And you've told us it is more in the young adult. We've often said abstinence is best. But if you are not able to do that, just take yourself and go to the family planning clinic to learn more on how to manage these things. We have the dermatologist. Don't be shy. Try as much as possible to visit your dermatologist. Thank you so much for coming.
Thank you very much.
Well, same time, we'll be back again for your regular program, The Physicians. I am Dr. Martina Agbere.
Till next time, stay blessed.